We have gotten through the pandemic. Some people argue certain elements are still with us, but I'm curious to what you think about the prospects of quality people entering the field of medicine, given the fact that so many are ready to leave it based on what they experienced during the COVID-19 pandemic.
Well, the good news is we're in a new place. We're in a better place than we've ever been. We've learned a lot of lessons. We understand this virus better than we've ever done before. We have the tools to protect ourselves. Actually, CDC just released updated guidance talking about simple ways that people can protect themselves. And top of the list is vaccination, right? And using the tools that we know work to save lives. That's why I'm excited to talk with our future doctors that are going to be those trusted messengers for our patients to help them understand why these life-saving tools are so important, how to use them, making sure that folks stay safe.
You're talking to future doctors today, but at one time you were in their shoes. Yeah. What made you want to do what they're hoping to do?
Oh, well, I was so lucky to see the field of medicine through my mom's eyes. She was a nurse practitioner in an emergency room. And what I saw, two things. One, I saw her be that caregiver in our community. People would stop her in the grocery store and say, "Thank you so much. You helped my mom, my sister last night in the emergency room." But the other side I saw was the broken parts of the healthcare system because she was in an emergency room. And so it gave me an appreciation both of how do you be that, trusted, caring person in someone's life when they're going through a hard time, but also how do you fix the system that I saw through her eyes that really wasn't working for everyone. And so I've been able to chart a career that's done a bit of both, being able to be a physician at certain times and then think about the larger system and how do we make it work for everyone.
Speaking of trying to make it work for everyone, you've been top of the line here at the state level, now you're doing it at the federal level, and you understand that sometimes you have to talk to people that may not think the same as you. One example is most recently the Department of Labor and the Commissioner has decided not to implement mask requirements in the field for people on construction sites if we were to find ourselves in another public health crisis. When you hear that, having been here, what do you think about that?
Well, look, I've loved working here in North Carolina, and what is so special about North Carolina is we have, I think, respectful disagreements sometimes. Look, we all know we're a purple state, but what I'm so proud of how we came through the pandemic, we really came through in a united way. I was so proud that we had 99% of our seniors got vaccinated. Did we agree on all the things? No, we didn't. But I think we were able to find a way forward to protect health, grow this economy at the same time. So I think we did a great job here in North Carolina. I'm really proud of us. And the good news is we're in a different place. As I said, we know that a lot more about this virus. We have the tools to protect ourselves. Vaccination continues to be the top thing that folks need to focus on. We're actually going to have an updated COVID vaccine later this year, we anticipate. So get ready now. Updated flu shot, updated COVID shot later this year. So we're in a different place. And so I just look forward to making sure that we can continue to have an open dialogue, make sure that we are moving forward, learning important lessons. That's what we're trying to do at CDC is embed those lessons in going forward.
But it also seems like there's somewhat of a backlash, to your point that, okay, yeah, we did this for 2, 3, going on almost 4 years, wearing masks, social distancing, washing our hands, and people seem to be rebelling against that, and to come out and say, hey, we're not going to implement this and make you wear a mask, to prevent the spread of infectious airborne diseases during public health crisis. I mean, that doesn't seem smart, but I mean, what do you say to that logic when we have mountains of data and research showing us there are some or many benefits to taking these precautions?
Yeah, as the CDC director, I am now very aware of all of the health threats that are out there. And while we're in a better place with COVID, there are There are other threats that are out there. It's why we do the work at CDC every day to protect health. We're not just here in this country, but we're globally. We actually have 60 offices around the country, making sure that we are preventing disease from coming to our shores. So there are other threats out there. So we're in a better place with COVID. We know that we have tools that work, but there are other bugs out there that we don't want coming here and certainly having the impact they had in COVID. And they don't have to, right? If we invest in making sure that we are protected, that we are doing all the things to detect and respond to the disease, we can be protected. But we need a strong CDC, well-funded, working effectively. That's what I'm focused on doing. But do we need tools to protect each other? Absolutely, particularly for bugs that don't have treatments, don't have vaccines. We're lucky that we're now in a better place with COVID, but that's not where we are for every health threat that's out there. So we need to make sure we have all of our tools at our disposal that we need to use to protect folks. And I'm focused on, again, embedding those lessons learned from the pandemic and making sure we have the tools available to protect each other.
So recently, the CDC changed the policy on the 5-day rule, about quarantining if you do have COVID. I'm wondering, when did you and other leaders decide, it's time we can sort of resume some of our normal activities, and if you're symptom-free for 24 hours or whatnot without meds, you can go back to kind of the way it was a little bit.
So I started as CDC Director July of 2023, and actually we started looking at our guidance right then. We were looking at our data to say, do we feel comfortable making a change in our guidance? And the answer was, well, right when I joined the CDC, COVID took the biggest change in the virus that we had seen in quite some time and actually had the biggest variant. And we said, look, we need to see that we can hold trends through another season, meaning we want to see less hospitalizations, less deaths through another season. And the good news is we saw it. While we saw a lot of virus circulating through this past winter, we didn't see as many hospitalizations or deaths, 75% down on hospitalizations, 90% down on deaths. It's a good thing. So we knew we could take this step to say, you know what, COVID is acting more similarly to flu. It's not exactly the same, but it's similar enough that we now feel like people can remember these simple actions that they can take similar to flu. Vaccination, washing your hands, ventilation, and of course, staying home when you're sick. Those are the important things, getting tested, getting treatment, right? So we're trying to keep it pretty simple for folks to do these things to protect themselves against any of the viruses that happen, particularly happen more often in the winter, COVID, flu, RSV.
So in your role, you are on the road 5 days a week, and you're meeting all kinds of folks. What did your time working for the Department of Health and Human Services for North Carolina teach you about how you want to approach your job as the CDC director?
Yeah. My time leading in North Carolina Health and Human Services for 3 years and then another 2 years during the COVID crisis was some of the most amazing, hard times of my career, and I've learned so much that I bring to the role as CDC director. Importantly, it's about building a foundation of trust. And I take lessons like making sure we're being transparent, right? So we're communicating effectively in a simple way, repetitively, right? Folks here in North Carolina remember how often we were on television through the COVID pandemic, sharing everything we possibly could in real time. So transparency, communicating, really important. And the second part, though, it wasn't just about saying words. It was about showing up for people and doing the work and making sure we were executing well, operating well. So I'm really focused on that. So for example, I was just in Birmingham, Alabama, focused on our work related to actually opioids and data related to overdoses, right? So because CDC does a lot more than just COVID and viruses, and making sure that we're operating well on the ground. And then the third, are those lessons you learned in kindergarten. It's about having good relationships, right? It's about showing up, being in person, caring about the other person, and understanding how you can work together and find those places where you do agree and you can move forward to build those healthier communities.
We're still moving out of, if not a little bit, still in the opioid epidemic. In North Carolina, certainly there are parts that were affected, and you can kind of say that throughout Appalachia, throughout the South. How seriously do you see us needing to treat that and provide these communities with resources moving forward?
Yeah, look, we've had a challenge with opioids for quite a number of years, but it has changed over that period of time. When I came to North Carolina in 2017, it was an opioid crisis. I was really focused on pills, right? And now we've evolved to a place where we're really seeing overdoses from fentanyl. And so it has we're seeing the same number of overdoses, but those overdoses tend to be more fatal because fentanyl is so powerful. And that's what CDC actually brings to the table, is that data and the evidence to say, look, this is what's happening in our communities, right? You can't solve problems you don't see. Here's the data. And also, we are able to evaluate best practices. Here's what we should do. And one of the most powerful things we can do is to connect people to treatment in that moment when they're having that crisis. So hopefully, if we've been able to save someone during an overdose moment, that's the time where you're like, hey, we got to get you into treatment. Here's how to do it, and really make that linkage to care. That's a best practice. Again, CDC data that drives some of those best practices.
What's going to be your message to the med students today?
Well, my message for our med students is want to thank you. Thank you for committing to a life of service. These are hard careers, but we are so grateful, and it is so important and necessary. You have so many amazing moments laid out for you, and to say we need you. This country needs you. We've learned so much over the course of the pandemic about how important our caregiving workforce, our physicians, our nurses, our pharmacists are to us being able to be healthy, and for all of us to be protected. So it's a thank you, it's a we need you, it's a work hard for us, and they're going to be the future leaders. So maybe one of them is the future CDC director. So I'm hoping to also give them a pep talk about why thinking about protecting health, public health, and going into a life of public service is also something I hope they think about as well.
Speaking of data, and lastly, I'm curious about your thoughts about the cyber attack, and I know that that is falling under the purview in terms of investigation with HHS, but in terms of data collection, what can we learn from this moment that maybe can improve not only patient health, but the safety of patient data moving forward?
Yes. So look, that cybersecurity incident, really reminds us about how important it is to protect data. We know that it is a precious resource. We know that we are in a steward of that data and have to be protectors of it. We focus a lot on that at CDC, though I will say a lot of the data CDC gets is population data, so it's not specific to an individual, and we want to keep it that way. When we don't need people's personal information, we don't want it, right? But when we need it in order to make sure that they are healthy and safe, it's really important, and then we have to be good stewards and good protectors of that information. We spent a lot of time thinking about it. This was a private company that had these challenges, and we in the government are leaning in to help in any way we can, both on the security side, understanding and investigating why did this happen, but also supporting those impacted. So certainly a lot of focus on cybersecurity, and will be more. I think healthcare, has become more of a target in cybersecurity. So we definitely have to make sure our game we're upping our game.
Right, Cohen. Thank you so much for your time.
So wonderful to be here.
It's always great to have you.
All right. Thank you so much.
Thanks for watching our YouTube channel. For more stories in your community, click the subscribe button here. You can also download the Spectrum News app or watch us on TV for the latest information, balanced coverage, weather updates every 10 minutes, and more. We'll see you then.